Infectious disease specialist Dr. Zain Chagla joins us this morning for his weekly update. Good morning, good to see you, and happy Friday.
Happy Friday, Bob.
Okay, so I feel like we have new vaccine names now. I feel like we're starting all over. So okay, so
yeah, let's just ignore all of that.
Can we
just stop?
Can we? So
No,
can we?
no,
Right
I mean,
now. So
yeah,
Pfizer's.
clearly.
Are we getting the pronunciation right? Is it Comirnaty?
Yeah, I think so. Again,
I
the
like
other ones are
Spike-vax.
easier, I think.
Yeah.
Spike-vax is easy.
Yep.
Vaxavera is easy, but yeah, that one. I think
Is
no one
it
is ever gonna
Vaxavera or Vaxzevria or? I don't know. I have
Vaxavera, I
think so. I have all of their albums. They opened for Iron Maiden in '89.
I know.
On
I
that
know.
tour.
I
Yeah.
know.
Anyways, but what was the deal here? So these brand names were around, but now that the drugs are approved, the brand names are in effect?
Yeah, exactly. We've been referring to these as like the Pfizer vaccine, or they had the scientific name, the BNT mRNA vaccine. But, realistically, the company does have the right to put names. I mean, this happens with flu vaccines too. We have AgriGrip and FluVax and other ones. We don't know what they are when they go into our arms at that point. So,
Right.
this is a thing. We'll call them the Pfizer vaccine, the Moderna vaccine, and the AstraZeneca vaccine for probably the long-term future. But
Okay.
scientifically in studies
Yeah.
and marketing, all that stuff, we just have to use these names, right?
Yeah. Now, with these vaccines, is there any evidence? We're seeing, of course, some breakthrough cases with fully vaccinated individuals. Is there any evidence that's showing one vaccine provides better protection than another?
There's a little bit of data from England suggesting that, again, the mRNA vaccines may have less of that breakthrough. Although when you start looking at disease severity and hospitalizations, it really is preserved for all of these vaccines. The one thing I will say, though, is, as we're getting along through time, it's not clear whether or not the AstraZeneca vaccine just kind of has a baseline protection that stays very nicely for time. And then the mRNA vaccines do a little bit more of a, start very high and start approaching the same as AstraZeneca. So, we're still in month 10 of our vaccine era, and we're still looking at data from people from December and January. We're learning a lot more by the day, but, rest assured, we're still seeing that these vaccines are protecting people outside of the most vulnerable people. And even then, to some degree, months and months and months after their initial vaccine was given.
Yeah, absolutely. And there's so many factors here. Age is an issue with efficacy, and some of these breakthrough cases, isn't that the makeup of many of them?
Yeah, absolutely. And, again, it's a bit of chicken and egg. Is it, age because they don't make a great immune response? Is it age and the fact they don't make a great immune response, and now we have the Delta variant, which may escape vaccines just a little bit more? Or is it the fact that they're the first ones vaccinated? And,
Right.
again, if there is going to be a little bit more waning, it's going to happen in the first ones vaccinated. This is what I think, places like the USA, the UK, Israel are trying to sort out now, because it has implications, right? If we're going to do boosters, it's fine. We should do them in a select population where they're going to matter the most. But we need to know which one of these things was the sum of its parts. And Canada is actually an interesting place because we vaccinated some of our 80-year-olds late as compared to other jurisdictions. And so we can kind of tease that out a little bit in terms of whether or not they're community dwelling 80-year-olds are different than long-term care dwelling 80-year-olds in terms of their risk.
Yeah, and speaking of booster shots, I wanted to get your comments on an article that came out of a peer-reviewed article that came out of The Lancet that was saying that boosters are not necessary yet. But the FDA is looking at Pfizer today, approving it as a booster shot. And we know how you feel about booster shots, but speaking of waning efficacy and protection, when will we need booster shots, do you think?
Yeah, I mean, I think the jury is still out. The data that's being provided to the FDA by Pfizer is really a small subset of patients. It's a small subset of 300 people where they're seeing a waning efficacy amongst them from the original clinical trial. So, I think, again, for the vast majority of the general population, we're not sure when the timing is, and it's probably months away for that older population, for that population with major immune problems. It probably is sooner rather than later. But again, this is still ongoing. It is still important that we sort out these questions right now. Who needs one? Because if we're just going to give it indiscriminately to the population, again, there are global implications for that. And again, we could be left with more variants and everything, repeating itself over and over again.
Absolutely. Okay, well, that's our time until we'll talk again next week about Pfizer, Moderna, and AstraZeneca. That's what we're calling it.
Exactly.
See you next week, and have a good weekend.